So next, I would like to introduce Dr. Karina Thomas from the Alberta Jobs, Economy, Trade, and Immigration Ministry to discuss what's happening in Alberta with workplace psychological safety. Her role encompasses leading evidence finding to support occupational health and safety policy and program development and delivery and evaluation for continuous improvement and accountability in the occupational health and safety program. Her team administers the Supporting Psychological Health in First Responders grant program, and these activities inform the province-wide occupational health and safety system, which aims to create safer work environments in Alberta. Dr. Thomas has a PhD in public health and over 20 years of experience with the government of Alberta, including leading the work for the psychosocial hazards pillar of the Occupational Health and Safety Prevention Initiative. Okay, so I'll turn it over to you.
Thanks very much, Daryl. That was sure a mouthful. And thanks, Daryl and Val, for inviting me to come to share some of our ministry-led initiatives supporting mental health here in Alberta. Just to check that you can see my screen, or you can see my slides anyway.
Yep.
Fantastic. Excellent. Great. I will move on then. So today what I'm going to share with you is I'll talk a little bit about our prevention initiative. I'll talk about the Supporting Psychological Health and First Responders grant program. And I'll also talk about some of the other resources that we generate here in the Ministry of Jobs, Economy, Trade, and Immigration. We just had a name change last week, so I'm happy I remembered that all. All right, so moving into the OHS Prevention Initiative. So the Prevention Initiative really focuses on the three most common injuries and illnesses in Alberta workplaces. So these are topics that either we haven't been able to move the needle on over time or are relatively newer considerations. So slips, trips, and falls, of course, are slips, trips, and falls. Musculoskeletal disorders are injuries to bones, muscles, ligaments, tendons, and nerves. And psychosocial hazards include injuries and illnesses resulting from workplace violence, harassment, and mental health issues. So the OHS Prevention Initiative also focuses on workforce types known to be at higher risk of injuries and illnesses. So small businesses, particularly private sector employers who have less than 20 workers, and also workers with vulnerabilities. So individuals who have one or more of the following characteristics. So young workers aged 24 or less, older workers aged 55 or higher, temporary foreign workers and migrants, Indigenous workers, workers with a short tenure of work, or which is sometimes called precarious employment, which includes temporary, seasonal, or casual work contracts or arrangements of up to 6 months, and also workers who have multiple jobs at once. So focusing more on the psychosocial pillar here of the prevention initiative. So really the aim of the prevention initiative is to address mental health in the workplace in an Alberta context and to really develop that discussion of mental health and wellness in Alberta workplaces. So we know that psychosocial hazards differ from the other two pillars, the slips, trips, and falls, and musculoskeletal, which are kind of your more traditional workplace hazards. You can see them, you can feel them, they're physical injuries. Whereas psychosocial hazards, as we all know, because we're here, is kind of a newer consideration or a newer topic in workplace health in that it's come to prominence really in the last several years. And you can't see it like you can a physical injury or illness. But what we do know is that workplaces that are not healthy and safe psychologically can contribute to mental injuries and illnesses, just as workplaces that are physically unhealthy and unsafe can lead to physical illnesses and disease. So in Alberta, psychosocial hazards need to be considered in your hazard assessment and control activities. That's actually in our OHS Act. And in addition to being the law, we know that there are financial benefits to considering psychosocial hazards as well to employers. So in our in our resources that we've developed to support the prevention initiative here, we do talk a lot about barriers to psychological health and safety in the workplace. Those include stigma, lack of knowledge, aversion to change. We discuss ways to address some of those barriers, and we provide some guidance on how to do a hazard assessment for psychosocial hazards. Some of the resources we developed to support the initiative includes bulletins, videos, posters, and postcards. And I'll go through some of these in more detail here. So in order to develop the content and really the resources for the prevention initiative, we worked with panels of industry stakeholders and certifying partners to make sure that we were actually considering many different points of view. And so some of the resources that we developed were things like this poster, Preventing Psychological Hazards in the Workplace. This one's talking about barriers. On the left of the screen here is a screen capture of our OHS resource portal, which I'll talk about in a little bit as well. So here's another example of one of our resources. So this poster focuses on hazard assessment for psychological hazards. Psychological hazards, as I mentioned before, must be included in the workplace hazard assessment process in Alberta. So in addition to some of our resources, I also wanted to point out that the CSA National Standard for Psychological Health and Safety in the Workplace also provides guidance for conducting hazard assessments. In addition to the posters that I'm showing here, we also have bulletins talking about the importance and benefits of addressing psychological health and safety in the workplace, as well as bulletins about the barriers, so going into more detail about the barriers and also how they can overcome. And all of the resources that we created related to psychological or psychosocial hazards in the workplace do align with the national standard. So in addition to the prevention initiative resources, we also have other resources that are relevant to psychosocial hazards in the workplace, specifically speaking about harassment and violence. So on the screen, I have a couple of examples of our harassment and violence specific resources. So the top left explains what harassment and violence are and the legal obligations of employers to protect their workers. The bottom left bulletin provides information on domestic violence as a workplace hazard. And on the right, we have an awareness poster outlining what we mean by harassment and violence and how to address situations involving harassment and violence in the workplace. So I do want to mention that all of our resources are free and they're developed for all Albertans, but they are accessible by everyone. They're meant to be used in workplaces and shared with employers and workers. And I will put the links in the chat after I'm finished talking here to our online resource portal and kind of specifically where you can find some of these resources on the online resource portal. So shifting gears here a little bit, I'll talk about the Supporting Psychological Health and First Responders Grant Program. So Supporting Psychological Health and First Responders, or SPHIFR, we're government, so we like a good acronym that we can say as a word. SPHIFR was established in 2020 in response to the growing recognition of the mental health challenges faced by first responders. First responders frequently encounter stressful, dangerous, and traumatic situations as part of their jobs, and this leads to significant higher rates of post-traumatic stress injuries, PTSIs, compared to the general population. So as our program developed, we expanded that population beyond first responders to include other emergency workers who encounter similarly stressful and dangerous situations at work and are at risk of PTSIs. So ultimately, the purpose of this SPHIFR grant program is to try to reduce the effects and ultimately the rates of PTSIs among Alberta's first responders and emergency workers by providing dedicated funding streams aimed to deliver both direct services and also to support applied research. So the focus of the funded projects and services is on effective evidence-based prevention and intervention strategies. So this can include the evaluation of existing and new programs. And I'll give some more examples later on in my talk here. So ultimately, this FIFER program aims to improve mental health supports for those who face stressful and traumatic situations in their line of work, trying to ensure that they receive the care and interventions that they need in order to prevent or lessen the severity of PTSIs. All right. So, just a few definitions. So we do have some fairly strict definitions in Alberta. First responders are defined in the Alberta Workers' Compensation Act, and they are defined as firefighters, police officers, paramedics, sheriffs, and corrections officers. As I mentioned previously, consideration of emergency workers was added to this FIFER program after the initial launch. And emergency workers, for the purpose of our grant program, are those who encounter serious, unexpected, and often dangerous situations requiring immediate action as part of their jobs. So some examples of folks who we would consider emergency workers for the purpose of the grant program include social workers, children's services workers, support staff in organizations dealing with potential dangerous clients, and nurses and physicians, especially those that work in emergency rooms. And the last definition, post-traumatic stress injury, it's a broad and non-clinical term. And for this grant program, it includes a range of mental health injuries, including operational stress injuries, anxiety, depression, and PTSD, post-traumatic stress disorder. So this FIFER grant program has two streams. So our first stream is the services stream. So in this stream, we fund projects that provide services that support first responders or emergency workers who are living with or at risk of PTSIs in Alberta. The organization requesting funding for this stream of the program must be a not-for-profit or a public sector organization. For Stream 2, our applied research stream, we fund qualified researchers to conduct research that develops and evaluates effective programs and services to support Alberta first responders or emergency workers living with or at risk of PTSIs. For both streams, the projects must be 12 months in duration. So the program's been running for 5 cycles now. We just launched our 6th cycle, and our application period just closed on Monday. So our budget every year is $1.5 million. So occasionally we're allowed to go a little bit over that, by not by a huge amount. So I'm not going to go into this in huge detail, but yeah, you can see that we easily are spending our budget every year. So cycle 5, you can see that we had quite a big jump in applications. We had 59 applications in cycle 5. The dollar ask for that was about $7 million. This year, we had 71 applications for this cycle of FIFER, and the total funding ask was over 8 million. So, and our budget remains at 1.5. So we're going to have some pretty big decisions to make. Our review process is really robust, and it's multi-stage. If folks want me to go over that, or if you're interested in how we review our grant applications, I'm more than happy to connect with folks after this talk. All right. So again, FIFER projects don't necessarily need to provide services only to individual first responder and emergency workers. Our goal is ultimately to support these workers in the best ways possible. So that means that we're also reaching, or at least trying to reach, those who support first responders and emergency workers, such as frontline supervisors or family members. So these folks play pivotal roles in supporting workers and their recovery or prevention of PTSIs. And so we want to try and provide some supports for those folks as well. So many of our services stream activities or projects that we funded deliver programming. So, for example, they might request funding to deliver peer support programs, expert-led training, drop-in psychosocial educational support groups, a variety of different types of programming. Programming that we funded has focused on workers themselves, but as I mentioned in the slide before, also families, supervisors, and also healthcare professionals that seek to provide care specifically for impacted workers. So we also look for culturally appropriate programming as well, and we funded a grant with the Stony Nakoda Emergency Medical Services, who incorporated sweats, picking sage and sweetgrass, smudging, and meditation in order to support the physical, emotional, mental, and spiritual needs of their EMS first responders. Other projects can develop and adopt tools, including some protocols and guidelines and various other things. So, for example, with part of the funding that we provided, the town of Whitecourt, Alberta, developed post-incident protocols and critical stress management guidelines. And they also adopted and implemented peer support guidelines and resources in addition to training and awareness building. We've also had some fairly unique approaches as well to increasing knowledge and support, including creating peer support helplines, and one project created a lending library to better disseminate information on PTSIs and mental health and resources that are available. So those are some examples of our services stream. With our research stream, there's a really broad range of successful projects that we've funded. So many of the research projects conduct surveys or interviews and focus groups to understand the impacts of traumatic events and PTSIs. Also to better understand workers' experience and knowledge about PTSIs, and to understand factors that affect uptake and effectiveness of interventions. So, for example, researchers from the Institute for Work and Health in Ontario conducted interviews with key informants from Alberta first responder organizations to create a better understanding about the implementation of PTSI policies and programs, including barriers and facilitators. Other research studies have developed or evaluated the effectiveness of specific interventions or program implementation for specific workers. So examples of some of those interventions included using wearable devices to monitor PTSI precursors or wrists. So that was really kind of a wristband device, similar to a tracker that you might wear on your wrist or an Apple Watch, that kind of thing. Treating post-traumatic stress injuries in first responders using transcranial magnetic stimulation, and also using virtual reality for the self-management of PTSI and first responders. Some examples of evaluation include evaluation of a reintegration program for police officers with the Edmonton Police Services. In this one, they looked at if the program helps to enable return to work and if it affects organizational mental health knowledge, stigma, and workplace culture. They were also looking to see if that program could be adopted for ICU and ER nurses. One of the other studies that we funded evaluated an online psychoeducational support program for emergency healthcare workers, specifically nurses and social workers. This was a program that was co-designed with nurses and social workers, and it featured virtual CBT and real-time feedback from an AI stress assessment tool. And lastly, research projects may also develop materials for community partners and stakeholders based on the study findings. So these could be in the form of workshops, skill toolkits, and programs as well. All right. So I also wanted to talk briefly about some of the other resources that we have and that we generate in-house to support not only mental health in Alberta workplaces, but really occupational health and safety generally. So I mentioned our OHS resource portal. So our department's OHS resource portal houses over 400 resources that are created and maintained by our staff. This particular screen grab shows the portal's homepage, and it shows you the categories that you can search by. Frequently used categories include what's new, what's most popular, health and safety topics, and our new legislation changes category, because we're in a kind of continual state of updating our OHS code. The team who creates these resources is continually looking for ways to improve so that stakeholders can find information and resources in the most efficient ways, and also to highlight resources or resource categories. We do have print copies of some of the resources that are available, and you can order those for free on the website. Most of them you can download and print yourself. Many of our resources are available in other languages besides English. So some of the examples of those are Ukrainian, French, Arabic, simplified Chinese, traditional Chinese, Punjabi, and Spanish. The content for each language and additional languages are always growing. So you can check back from time to time to see if anything new has come up. I also wanted to mention our this website, which is how you can search our OHS legislation. So if you're interested in kind of finding out what is in Alberta's legislation, say specific to psychological health and safety or violence and harassment, you can actually type those into the search tool, and it'll bring up the appropriate parts of the acts, the regulations, and the code. So you can actually take a look at that. So that's had really, really good uptake. One last thing that I did want to mention, and this is not a ministry-led initiative, but it is led by Alberta WCB and the Alberta Municipal Health and Safety Association. So working together, those two organizations have developed a cognitive psychological job demands analysis tool. So this is very similar to the physical job demands analysis tool, but it's for cognitive tasks and psychological safety in the workplace. So the benefits of this tool is that it supports the OHS prevention initiative that I was talking about at the start of my talk. It helps to satisfy part of the OHS legislation and the certificate of recognition requirements for psychological hazard identification, assessment, and control in the workplace. It can help support safe and timely return to work for mental health claims. It helps to identify position cognitive requirements and support accommodation requirements under the Alberta human rights legislation. It can help to mitigate escalating mental health claim costs. And it also visibly demonstrates support for psychologically safe workplaces. So, like I said, the development of that tool was led by the Alberta Municipal Health and Safety Association and the WCB Alberta. I'll see if I can put a link in the chat to that, but it might be best to kind of reach out to them directly for any information on that. And that is it for me. So thank you very much. I will stop sharing here. And just so you know, unfortunately, I do have to leave right at 9:30, so I probably have time for a question or two, but then unfortunately, I will have to leave. My apologies.
Okay, we have a question here from Genevieve. So on the topic of psychosocial hazards in the workplace, what does your process for reporting psychological injuries in the workplace look like? Do you report it in the same way as you would a physical injury? And how are the psychological injuries investigated? Do you have trained investigators on the job?
Yeah, so psychological injuries should be reported the same as physical injuries. And we are in the process actually of creating and providing training for our OHS officers to go and do those investigations.
Great. And one more. So wondering if you can comment on the uptake of the psychological health and safety resources and whether there are health and safety associations there who further customize them to their industry or other contexts. And also wondering if the inspectorate office offer info on these resources during visits and in what context. And maybe you just answered the last question on the municipal sector.
For sure, that was a lot of questions in one question. So I'll try and answer them all, but I might get you to help me if I miss some. So the uptake of the OHS resources, I don't have the numbers on me right now, but they're definitely in the thousands as well, for sure. So, but it depends on the resource, of course. Some of we do have an occupational health and safety toolkit, which kind of helps employers set up. How do you set yourself up for occupational health and safety? That one's quite popular, as is the hazard assessment and control document, which walks you through how to do your hazard assessment and control. So those are two of the more popular ones. And that is tracked. But it's not my team who leads that, so I don't have the numbers kind of off the top of my head. Sorry, what were the the other parts?
Also, do the inspectorate offer these info on the visits?
Yeah, they can. Absolutely. Yeah. Either I think they've gone away from actually handing out paper copies, and they'll provide the links.
Okay, and then one more. Can you repeat who is included as emergency workers?
Yeah, so emergency workers are they're quite let me just get here. Yeah, so emergency workers, it's a bit of a fluid definition. So emergency workers are those who encounter serious, unexpected, and often dangerous situations requiring immediate action as part of their jobs. So the folks that I mentioned are just some examples. What we do accept is if someone applies to this FIFER program, what we ask is that they basically provide the rationale for why the population that they're interested in supporting could be considered an emergency worker. We're also very happy to answer questions during the application period or really at any time during the year. So if someone has a question about whether the population they'd like to support would qualify as an emergency worker, we're more than happy to have that conversation with them and to discuss, the rationale and the reasoning for that.
Okay, great. Thanks. I think that is all the questions for you.
Great. Thanks. Before I pop off, I will put some links in the chat, and I'll also put my email address. If people have further questions, they're more than welcome to reach out to me directly.
Great. Thank you.
Thanks.